So if we take a look at some of the specific disease processes, starting with patellar tendinopathy, this is often referred to as jumper's knee, but also known as runner's knee, seen commonly in a running population. Certainly is the most common in jumping type of athletes, where some studies have shown 20 to 30% of athletes who are jumping will experience this at one time or another. Sports such as volleyball or basketball tend to have this the most common, and actually has been shown to be a reason for retirement in professional athletes at a high prevalence. With respect to running, patellar tendinopathy may account for 5% of injuries that we see in runners. And the patellar tendon, as we looked at with the anatomy model, is under a lot of repetitive stress and is in a situation to transmit sometimes as much as 4 times the body weight during running, and this is a reason it's affected so often. So as far as symptoms that we look for that the patient may experience or that we may pick up as clinicians, could be pretty straightforward to diagnose. The pain is located typically in the patellar tendon below the kneecap area. Often it will start off being experienced as some morning stiffness when getting up or after sitting for a long period of time. Things that really load the patellar tendon, such as squatting or lunging or running downhill, will tend to bring out these symptoms more. You may notice that it's tender to the touch, so the examiner may notice that we have some tenderness palpation, or you, the patient, may notice that you have some tenderness there at times. This can progress over stages to become painful with normal activities. Typically, when it starts off, the pain will be noted during the activity or at the start of the activity. Achilles tendinopathy, again, fairly similar, even a higher prevalence in runners. So this can be up to 36% of runners experiencing Achilles tendon-related pain. In a study looking at recreational runners, this was found to affect 9%. Again, similar to that patellar tendon, the Achilles tendon is absorbing a tremendous amount of force with every stride that we take with jumping or with push-off. A lot of these problems can come up, as Ben mentioned in the introduction, after a sudden increase in activity or a change in our training. So we can see this due to training errors, due to ramping up too quickly, or going from sort of a couch to 5K and trying to add new exercises and having some of these relative overuse problems. And the classic with Achilles tendon is seeing a lot of middle-aged males in particular with sort of a weekend warrior picture where there's inactivity during much of the week and then going out and going a little too hard on the weekends.